Hi everybody, welcome to my channel. If you're new here, I'm glad to see you. If you're coming back, welcome back. Happy to have you back here again. I think that I would like to talk about some common questions that people have about end of life, such as, do people hear at the end of their life? Just as one example. I made myself a little set of notes just so that I could cover it because I have a tendency to go off script and go on my soapbox and go on a tangent. So I'll try not to do that. But let's talk about questions that family members have at end of life commonly that I've heard. One of the questions is, do people hear at the end of their life? And yes, hearing is believed to be the last sense that goes. Even if someone is not responding to you or they're not showing you a sign that they're hearing you, they can still hear your voice. So I say to people that it is very important to talk to your loved one when they're at end of life, reassure them, play the music they love, play a television program that they enjoyed. People do hear you. They are hearing you, even if they aren't able to give you that confirmation that they're hearing you. It is believed, again, that that is the last sense to go, and I encourage people to encourage family members, and if you're a family member, I encourage you to talk to your loved ones, sing to them, play music that they love, and provide them that comfort. Sometimes they're not able to share with us the fear that they may be feeling, and just having you there with them can ease that and help them feel more comfort. Do they know I'm there if they don't respond? Are they knowing that I'm there if they're not responding? Yeah. They are. Even without their words of acknowledgement, even without them being able to confirm that they know you're there, your touch, your presence, it's also important. It's powerful. Families often feel unsure, but I do reassure them that their loved one knows that they are there. That's a very emotional topic. I have been in situations where I have been with people who don't have family, and so a lot of times nurses at the hospital, nurses in a facility, or myself in a home situation, or a CNA will sit with the patient if they don't have someone with them, just so that they have someone there with them, because I think it does make a difference at the end of life to have someone there with you. Why are they sleeping so much? It's a natural part of the body slowing down, and as energy decreases, people rest more. It's usually not caused by medication. It's the body's way of preparing. When we get toward end of life, we sleep more, we eat less, we don't burn as many calories, so we're not needing the food, and our body is preparing to shut down. So it is doing those things systematically. Why is their breathing changing? Families often wonder about that. The gurgling sounds, which is that sound that you sometimes hear accompanied with death. I do demonstrate that for my patients. You'll often hear that at end of life, and it's a little bit more wet sounding because there's secretions involved. Often then we start seeing apnea, where people are holding their breath, it seems like, where they're not breathing for a short period of time, and Cheyne-Stokes. These changes look concerning, but they are a normal part of the dying process, and it's usually not uncomfortable for the patient, but we do have medications to manage those things. Morphine, hyoscyamine, scopolamine patches. I'm probably mispronouncing these medications, but we have Levsin, we have transdermal scopolamine, which goes behind the ear. We have atropine drops that we can use to dry up secretions, but honestly, if you turn the patient to their side, this often will help those secretions to drain out on their own. It really is not as uncomfortable for the patient as it is for the family. It just sounds really noisy. Are they in pain and they can't tell us? So people have nonverbal signs when they're in pain, like we do. They're not going to always tell you they're in pain, and especially in that generation. Anyway, I've had them tell me they're not in pain, but they're really wrinkling up their face. So you'll see tightening, grimacing, clenching of the jaw. Those are all nonverbal signs of pain. So those are things that you can teach your families to look for. Those are things that you can look for as a nurse. And restlessness, when they just can't seem to get comfortable and they're moving, or they're swinging their leg, or tapping their hand, or those sorts of things. Those are all nonverbal signs of pain that we're looking for. Is it normal for their appetite and their thirst to stop? Yes, it is. This is a normal part of death and dying, and it is our body shutting down. Again, we're not needing those calories. Our body is preparing to die, and we become less thirsty, less hungry until we're not eating and drinking at all. Forcing food or water can actually cause more discomfort and can lead to choking. So if you give somebody this food or make them drink when they're not really wanting it, it can cause them additional discomfort. And it's okay. It's okay for them to stop eating. If they ask to eat, absolutely feed them. If they're safe to eat and swallow and drink and swallow, if they're asking for these things, absolutely. But if they're telling you no, this is a normal part of the death and dying process, and you shouldn't feel guilty because it's not anything that you're doing. Their body is shutting down, and this is when we need to be giving good mouth care. With swabs and things like that, keeping their mouth moisturized, keeping it clean because it's going to get dry. Will they wait for someone before passing? Often, yes. I have had this conversation. I think this is a debatable topic. I believe that every person has their own little checklist. In my experience of watching people die over the years, over the last 24, 25 years in nursing, in my 4 years as a hospice nurse, I do believe that sometimes people will wait until a person comes or wait until a person goes. They absolutely will. That's what I was just thinking. I touched upon what I wrote. So some patients will wait until all the family leaves the room and then they will pass. They hold on, it seems like, until everybody leaves the room. They don't want to die when everybody's present. And I have seen people hold out for weeks until just that one person shows up. Yes, it's your time to go when it's your time to go, but I just wonder if there's not a little wiggle room or a little bargaining going on behind the scenes, because it seems like, or maybe it's all in time, even when we're thinking of a person waiting. Because when someone is dying, it is not in our timeline, it is in their body's timeline. It's going to happen when it's going to happen, regardless. And it does seem to me, in my opinion, that people often wait for someone to show up, whether that be a child. I've seen someone wait for their ex-spouse, a brother, a sister, someone that they haven't seen for a long time, a grandchild that they really have a good connection with. I've seen people wait for that. And another question is, what should I say to them? These topics make me emotional. You wouldn't think I'd be so emotional after so many years of nursing and so much death, but it still makes me very emotional when death is happening. What should you say to them? The most powerful words are going to be simple words and genuine. I love you. Thank you. Please forgive me. It's okay to go. I'm going to be okay. I've heard families reassure their loved ones. Just your presence is mostly needed and appreciated, but you don't have to get real wordy. You can hold their hand, hug them, kiss them, be beside them. But I love you is very powerful. I love you. I appreciate what you did for me in my life. I appreciate how you contributed to my life. Those are the types of things I might say to a loved one if they were at end of life. But these are the kind of questions that I do hear on a regular basis when I'm in families' homes and in facilities. Sometimes this is the first time someone is losing someone. They don't have anything to go by, or maybe they've experienced death before, but not of their mother, not of their father, not of their sister, not of their brother, not of their child, God forbid. I've seen that too. Thankfully, no pediatrics on this side of things, but they have questions and we have answers. And if we don't have answers, we know people who do on our team, I'm sure. Your presence and your love matter more than anything else to your patients. Their family's presence and love matters more than anything else to the patient. It has been my honor and privilege to be a nurse to people at the end of their life. What are some experiences that you've had with patients at end of life and their families? What are some common questions that you get that I maybe didn't touch on? I'd love to hear about it in the comments. What are some questions that you have? Let's talk about it. I'd ask that you like, subscribe, and follow if you want to hear more. And I thank you for watching. Bye.